On March 11, 2020, the World Health Organization officially changed its designation of COVID-19, the illness caused by a coronavirus, from an epidemic to a pandemic. Pandemic is an outbreak of a disease that occurs over a wide geographic area and affects an exceptionally high proportion of the population. Until 22nd of May 2020, there are 5 million infected peoples from 174 countries and 332,000 people have died. Today, with roughly 4 billion people live in cities, more than half of the world's population, they intensify the spread and transmission of infectious disease through increased human contact. That's why urban planning is a part of the solution. Urban or city planning plays a central role in preparing for, mitigating, and adapting cities to pandemics. In fact, many of the norms and rules for cities to manage infectious disease were first discussed at a global sanitary conference in 1851. Some of the most iconic developments in urban planning and management in the past, such as London's Metropolitan Board of Works and mid-19th century sanitation systems, developed in response to public health crises such as cholera outbreaks. Now, COVID-19 is joining a long list of infectious disease like the Spanish flu of 1918 in New York and Mexico City, or the Ebola virus disease in West Africa in 2014, likely to leave enduring marks on urban spaces. While still too early to declare success, the early response of Taiwan to the COVID-19 outbreak stands out. When the outbreak first started in January, some experts predicted that Taiwan would have the highest number of cases outside of mainland China. The island of 23 million is just 81 miles from mainland China, with frequent flights back and forth and hundreds of thousands of Taiwanese citizens who live and work in China. Taiwan had 2.7 million visitors from China last year. All signs pointed to the novel coronavirus being bad news for Taiwan. But until today, Taiwan has kept its number of confirmed cases below 500. So, what did Taiwan do different? Taiwan has been able to draw from its experience of the SARS epidemic of 2002, where the mortality rate was much higher. Taiwan, which is not part of the World Health Organization, decided to screen all passengers from Wuhan starting on December 31st, the same day it learned of the unknown virus in the Chinese city. The Command Center investigates confirmed and suspected cases, as well as coordinates the response across Taiwan with ministries and local governments, including allocating funds, mobilizing personnel, and advising on the disinfection of schools. Taiwan has rapidly produced and implemented a list of at least 124 action items in the first 5 weeks, that's 3 to 4 per day, to protect public health. To secure its border, Taiwan had first suspended entry for all travelers from Wuhan on 26th of January, 5 days after the first confirmed case in the country ahead of other countries. Later, entry restrictions were also imposed on flights from all China's cities, and only Taiwanese are allowed to fly in the country. Anticipating the high demand of masks in late January, the Taiwanese government started rationing the existing supply of masks. Taiwanese citizens have to line up and buy a specific amount of masks on a weekly basis. It was also reported that the Taiwanese are not allowed to mail masks overseas. Those who violate this regulation will be fined up to 3 times the value, and the masks will be confiscated. Taiwan also set up new production lines and dispatched soldiers to staff factories significantly increasing production. This increased Taiwan's daily mask production capacity from 1.8 million masks to 8 million masks. This has been called Taiwan's mask miracle. These masks are the tool for residents in Taiwan densely populated cities to protect themselves. They made them feel safe and not panic. Taiwan government also have challenged in combating misinformation. So, television and radio stations in Taiwan have broadcasted public service announcements on how the virus is spread, the importance of washing hands properly, and when to wear a mask. The Taiwanese government has also used data technology to help medical personnel identify and trace suspected patients and high-risk individuals. Learning from past experience of the SARS outbreak, a temperature monitor has already been set up at Taiwan's airport to detect body temperature of visitors. At the same time, Taiwan CDC will also receive data from passengers who scan a QR code to report their travel history and health symptoms online. The mandatory home quarantine for 14 days was also imposed on those who come from badly affected areas, and their locations will be tracked by using location sharing on their mobile phone. The people who neglect the quarantine notice or do not report symptoms will get heavy fines. The authorities in Taiwan also quickly determined whom the confirmed cases had been in contact with and then test them and put them in home quarantine. They also proactively find new cases by retesting those who tested negative.